How are you these days?
We're good. We're getting used to family life at home. Working from home has huge benefits in terms of seeing the children and huge disadvantages in that they constantly interfere with my work. But we're surviving well. Thank you.
Yes. Right now, I'm also waiting for Kun Thep Chai to be back online so that he can join our conversation. So, Ambassador, for how many days you have been working from home?
So I probably spent, of the last 3 weeks, I've been outside the house maybe twice to go into the embassy. We're running essentially 95% of our staff are working from home at the moment. And we run on 2 shifts to make sure that we can have business continuity if somebody gets ill. So I have been following the government advice, working principally from home and only going out when absolutely essential.
Yes, and when I take a look at UK Facebook page, UK Embassy, you have been updating information and you also have your own video clip telling UK residents in Thailand what they should do. So far,
That's
what
correct.
do you like to communicate with them?
So we have been updated. So although we are mostly working from home, as I say, 95% of our staff working from home, we are continuing to provide a full embassy service. And part of that, and in fact our principal response at the moment, is to British nationals, tourists, short-term visitors here in Thailand. So we monitor very carefully the situation in Thailand, and we try and relay the most accurate factual information to British nationals to encourage them and to help them get on flights back to the UK. And my videos are designed really to get across a clear message that there are commercial options available, that those wishing to return to the UK should do so now. If you're intending to stay in Thailand, you must make sure that your plan to stay is viable and future-proof. You need to look at your travel insurance, your health insurance, your funding. You cannot be a burden on the Thai state. And if you have a plan that covers all of those and can withstand stricter restrictions put on your travel within Thailand, well and good. If not, there are flights back to the UK with empty seats, and you should get on them now.
Do you have any idea how many British citizens here in Thailand who may need help or advice from the embassy?
So we have, there are 2 sets of groups of tourists, groups of British nationals here. The biggest group, of course, is our long-term residents, and we have between 70 and 75,000 British nationals who live and work here and who have the relevant medical insurance and are settled here. On top of that, as you know, we have around 1 million tourists a year from the UK into Thailand. So at the moment, obviously, that number has dwindled. We are running an email inbox to register people who want to go back to the UK. That has around about 1,000 people. We've already issued around 1,800 letters to support visa extensions. So those are people we suspect are here also. There may be up to 4,500, 5,000 people on short-term visas who may be looking to return to the UK, but are probably here in Thailand. Quite difficult to get to precise figures.
And you must be having press briefing, daily briefing every day with the UK side. What's the latest situation?
So daily briefing multiplied by about 3 times. I have about 3 briefings a day. You'll be familiar with that. No, I think I heard a little bit of your earlier report. You will know from the news reports that the UK has quite strict restrictions now on movement within the UK. We are definitely applying the social distancing rule. All our advice really, and all the measures we take are really based on health and scientific advice. And I would say that we have essentially 4 pillars to our response in the UK. Firstly, around social distancing. Like many places in the world, British people are really only allowed out of their homes to do essential tasks, to shop for supplies, to seek medical treatment, and 1 form of exercise a day. And that allows us really to prioritize support for the most vulnerable in our society. So the elderly, the people with underlying health concerns. And there is almost a policy of near isolation for those most vulnerable category. We are fortunate to to have a huge army of volunteers in the UK. Around 750,000 people have volunteered to help the health service or to look after in terms of delivery for these people in care. So that is one aspect. The second bit is really gearing up our National Health Service, which is fantastic and has incredibly committed people to meet the challenge, to increase the targeted testing of people, to increase our capacity in terms of the number of critical care beds, new temporary hospitals, and thousands of beds being constructed. The third pillar really is around our science and research and innovation element, using our academics and our world-class leading universities to model what the spread of COVID-19 will look like in the UK and how the health system will cope, but also to take part in vaccine trials. And Oxford University, for example, is one of the leading vaccine candidates for COVID-19. And I think the final part, which is also critically important and people often forget, is around the international dimension. And part of our focus is to make sure that we are working through the World Health Organization with partners, including Thailand, to solve the challenges of COVID-19 through cooperation and in particular through joint research. So, you will see in the situation in the UK a very strict set of measures being enforced gradually, proportionately, to try and delay the onset, to make sure that we have the system in place to cope with it. And all people in the UK, I have to say, are using healthcare in hospitals for the critical and asking others with mild symptoms to self-isolate, in line with what many other countries are doing. But I'm amazed at the extraordinary response of everyone in Britain. And let's remember that not everyone in Britain is British. There are many nationalities there, including Thai, who are playing their part in helping us in the UK control COVID-19. And I hope very much, and I expect very much, British nationals here in Thailand to be doing the same in support of the Thai government's response to COVID-19 here.
Mr. Ambassador, I'm sure that you must have seen this grim forecast by the School of Medicine in Seattle of the University of Washington, which put the number of potential fatalities in UK at 60,000 by August. And a lot of British scientists are pushing back against this forecast. So do you have any information on this?
I don't have any information on that, except to say that, I think our response in the UK is led by science and our own analysis. There's no doubt that people individually are concerned about COVID-19. I myself have a very elderly mother, elderly relatives in the UK. I know a lot of Thai people here have sons, daughters, relatives in the UK. So on a personal level, of course, we're worried by COVID-19 and the response. But what I can say is that if you look at the commitment of health professionals within the system, if you look at the scientists, the researchers who are doing work to try and model and mitigate and delay the onset of COVID, I think we have a very strong response, and I'm confident that the government is leading a proportionate and scientifically evidence-based action to deal with this.
Ambassador, but right now, Prime Minister Boris Johnson is in hospital in intensive care unit. So who is running the country?
Well, the Prime Minister, obviously, we all wish him well. Like anybody, who is in intensive care now, our thoughts and prayers are very much with him and his family for a speedy and full recovery. But, obviously, in a well-oiled democratic machine like the UK, there is an entire government structure which kicks in. So, the government has a plan for responding with this. It is led by the cabinet. The Foreign Secretary is currently the sort of first deputy minister. So, in a sense, in the day-to-day, he is taking some of the decisions, but very much a cabinet response and a plan that has been agreed by the whole of government. So, while the Prime Minister is currently out of action, there is still a whole of government effective, consistent response.
Now, having the Foreign Secretary deputizing for the Prime Minister who cannot carry out his duty, is it something done by tradition or is it by law?
So the Foreign Secretary, though, he is actually has a separate role, which is essentially is the Deputy Prime Minister. So it's not always the Foreign Secretary. Sometimes that role is played up by somebody else. But in this case, Dominic Raab is the deputy to the Prime Minister.
I see. So, and you as ambassador, you report directly to him?
Directly to him, through a couple of layers, to be fair, but yes. Actually, I report directly to the Queen, I think, but anyway.
I see. You know, today the British government is supposed to decide whether to extend the lockdown, which was introduced back on March 23rd, right? And back then the government said after 3 weeks the lockdown would be reviewed. So it is the 3 weeks is almost up now. So have you heard any latest from London?
So I haven't heard the latest news, but I think it's absolutely right, as the Thai government is doing here, that you try and balance the sort of the health and security requirements against the economic impact. And in all of what the British government is doing, and I think also in what the Thai government is doing, it's about securing that balance. It's making sure that we review against scientific, medically based evidence what is the case for loosening or tightening restrictions. And that's the position the government, the British government is in. They will be taking a view now on how successful measures have been, whether it's enough that allows them to lift restrictions now, or whether we need to continue or indeed tighten restrictions a little longer.
Yeah.
But all of these decisions are made on the basis of the advice from medical and scientific professionals.
Now I have looked at the list of do and don'ts under the restriction in UK. I think they are quite similar to what we have here.
They absolutely are. In some respects, they may even be tighter.
No, but starting tomorrow in Bangkok, no alcohol will be available. But in UK, I mean, it's still, I mean, you can still buy drinks, right?
My goodness, you don't dare take away an Englishman's gin and tonic. That would be just sacrilege. Each country needs to respond to this in their own way, respectful of their cultural norms. And obviously, we understand here why in Thailand, with the Songkran holiday coming up, there's a clear rationale.
Yeah, going to be a very dry Songkran indeed.
And summer is approaching, Ambassador, and normally British people like to go out very much during summer. So what do you think going to happen this year?
Well, our summer is very short, and it's quite obvious why people like to go out when the sun shines. No, I think generally speaking, people are going to obey the instructions from the government. I think we all know very well that one of the best ways of delaying and containing the COVID-19 transmission is through social distancing. Stay home, stay safe. And I think British people, when you look at the rates of transmission in the UK. People are concerned not just for themselves, but for the most vulnerable in our society. The key to our response in the UK, as here in Thailand, is really about protecting those in our society who are most susceptible to the most extreme impact from this disease. And it is, it's not optional. It is a responsibility on every single person to look after our neighbours, and that means staying at home and staying safe. So I really do think in the UK that is understood by everyone, and I really do think that people will obey those instructions, and as a contribution will stay at home. I mean, Her Majesty the Queen made an address to the nation at the weekend, only I think the fourth and fifth time in her entire reign, where she's done a special address, and she talked about the sense of community and the sense that we were working together, and I really do think it's that sort of message that really resonates in the UK. This is something that we need to deal with together in the UK and with our international partners. It is a responsibility on us all to look after the most vulnerable in our society. It's a test of our character and our nationhood, and it's one that we here and we in Thailand will also come through, I think, strongly. So I don't think there will be people disobeying that instruction, because I think people understand this is about the whole community, not about the one.
And UK is at Brexit juncture. There must be quite deep division within the country. So how do you think COVID-19 has done to the country? Does it help unify all the British people right now?
Well, I think we're certainly unified in one cause, which is containing the disease and working to get over this global pandemic. I mean, you will know that there is a track of negotiations with the EU that goes on, not face to face, obviously, but by remotely. So, but I do think it's fair to say that in terms of people's perceptions and what they're thinking about. Most people are not thinking about the exit from the European Union. That's a process for negotiators, for politicians, for public service to take forward. What people are really thinking about is how they can protect their loved ones and the most vulnerable in society. And I think that is the right approach to be taking. And again, you know, Her Majesty the Queen made that very clear in her broadcast, that this is about the nation coming together to support each other and to protect the most vulnerable.
Mr. Ambassador, the Director General of the World Health Organization today has called for an end to the politicization of the coronavirus. How do you read this message?
Speaking entirely personally, I think it's absolutely right. This is a global endeavor. You know, we all know this. We're all in this together. The only way that we will deal with this global pandemic is by global cooperation. So he's absolutely right. You know, this is not about assigning blame to one group or another. It's not about looking at other individuals in society and making a generalized statement about, you know, their role in this or their contributory factors. This is about us coming together as an international community, working together particularly around research and vaccine. The United Kingdom is giving around £250 million to the organizations looking at developing a vaccine. We're looking to work with others, including here in Thailand, Mahidol University, to find a vaccine and to support the most vulnerable nations in the world to be able to sort of resist this transmission of COVID-19, and also to bring together the best minds in all our countries to develop a vaccine to approach that. You know, we are lucky here in Thailand that we have one of the best health systems in the world. I mean, if you look at the Global Health Security Index, it ranks number 6. We are incredibly lucky to have such a strong health system in Thailand, supporting the people of Thailand and all those nationals from other countries who are currently here. So, you know, we as the UK want to work through the WHO and with external other partners to make sure that we are playing our part in a global response to this. And so I support what the Secretary of the WHO said. This is not about either assigning blame or making generic comparisons between nations. It's about coming together to bring our best minds together to address the solutions.
Ambassador, right now you mentioned that research team are working a lot on vaccine. And when do you think it will be coming out? This year, next year?
That's way beyond my intellectual capacity. I'm not a scientist. I'm a humble, mere ambassador who knows virtually nothing about science. And I think, you know, I simply don't know the answer to that. I think all I can say is that what we all need to do is to sort of put our efforts, our money, our research, our best scientists on the problem. And they will come up. I'm confident they will come up with a problem, but only if we work together and only if we share our resources, our research, and make sure that we are looking at this with all the evidence and all the data we have across the globe.
Okay.
Mr. Ambassador, even though the situation here in Thailand is no less challenging, but I'm sure that the prayer of many Thais also go to the British people. Do you have any message for Thai people?
Well, my first message to the Thai people is thank you. I feel incredibly grateful and honoured, as do all of the British nationals here, to be in a society with such a great healthcare structure. I know from speaking to officials in the Ministry of Public Health how much thinking and preparation has gone into the response here. So a huge thank you, both for that national response, but also for the very small actions of kindness to me and all my colleagues here. But we cannot be complacent. And, you know, part of my job here is to make sure that British nationals here in Thailand understand that it is our responsibility to support the Thai government in containing the transmission. We must look after the most vulnerable in this society that we call home. So stay at home, stay safe.